Stop treating the signal, a clinical paradigm shift presented by Dr. Gurpreet Singh Padda at Regan.md. You have been trained by the current medical assembly line to look at your pain as the primary problem. You feel a sensation in your knee, your back, or your shoulder, and you immediately categorize it as a diagnosis. You walk into a clinic and you ask, "What is wrong with my knee? What is wrong with my back?" I am here to tell you that this question, the very question that drives the standard of care in orthopedics and pain management, is the root of your failure to heal. Pain is not a diagnosis, it is a lagging indicator of systemic metabolic failure. When you walk into a typical clinic, the physician is looking at that lagging indicator, they are looking at the pain. They are looking at the MRI scan that shows a structural change. They are looking at the X-ray that shows a joint space narrowing. And they are offering you a procedure to block that signal. They are offering you an epidural. They are offering you a nerve block. They are offering you a steroid injection. They are offering you a mechanical surgery to fuse or replace. These are all methods to turn off the alarm, but they do nothing to address the fire that triggered the alarm in the first place. You are effectively silencing the only feedback mechanism you have left. Today, we are going to stop treating the signal. We are going to dismantle the paradigm of pain management and replace it with the paradigm of metabolic restoration. Section 1. The scientific fallacy. Why imaging is not pain. We live in an era where we rely on imaging to define our reality. We assume that because we see a bulge on an MRI or a narrowing in a joint on an X-ray, that we have identified the cause of the pain. This is a fundamental misunderstanding of spinal and orthopedic pathology, as documented by researchers like Nikolai Bogduk. A foundational figure in the study of spinal pain, imaging is notoriously unreliable as a predictor of pain. You can have significant disc degeneration and zero pain. You can have a perfect MRI and debilitating pain. The image is a record of tissue anatomy, not a map of pain generation. When we treat the image, we treat the anatomy. We are not treating the patient. When you undergo a spinal fusion because of a bulging disc, you are engaging in a structural correction. Consider the seminal work published in the Journal of Bone and Joint Surgery by Hillebrand et al. In 1999. They documented the phenomenon of adjacent segment disease. When you weld a motion segment, you shift the mechanical load. You shift the load to the segments above and below. You do not stop the degeneration, you accelerate it. You are guaranteeing that the patient will return for a subsequent surgery because the fusion created a mechanical tyranny. We are treating the signal, the structural abnormality, and in doing so, we are creating a long-term disaster. We are failing to maintain the system. Section 2, the maintenance crisis. You need to shift your perspective. We are failing to maintain the system. Section 2, the maintenance crisis. You need to shift your perspective. Think about that word, maintenance. Your body is not a machine that simply breaks down because of use. Your body is a self-repairing organism. It is constantly turning over cells. It is constantly synthesizing new collagen. It is constantly repairing micro tears in your tendons and ligaments. It is constantly refreshing the matrix of your cartilage. If you have chronic pain, it means that this maintenance process has stalled. Your body has lost the biological capacity to rebuild. That is what a lagging indicator means. The pain you feel is the final, loudest cry for help from a system struggling. When you ignore the system and focus only on the pain, you are engaging in a dangerous deception. You are putting black tape over the light. If you have a check engine light on, you do not put a piece of black tape over it. You open the hood, you check the oil, you check the engine temperature, you check the fuel mixture. But in the current model, that is exactly what is happening. We are numbing the nerve, we are silencing the signal, and then we act surprised when the engine eventually seizes. We act surprised when the adjacent segments of the spine fail or the rotator cuff tears again. We should not be surprised. We should expect it because we never fixed the underlying maintenance failure. Section 3, the metabolic bottleneck. Why is your system failing to maintain your tissue? It is because your biological terrain is catabolic. You are living in a systemic environment that is actively hostile to tissue repair. This is driven by metabolic dysregulation. It is because your biological terrain is catabolic, actively hostile to tissue repair and metabolic restoration. He elucidated the link between obesity, metabolic dysfunction, and chronic low-grade systemic inflammation. This is the fire. He elucidated the link between obesity, metabolic dysfunction, and chronic low-grade systemic inflammation. This is the fire. You can have the most advanced orthobiologic procedure. I could inject the highest quality platelet-rich plasma. But if your systemic environment is acidic, inflamed, and insulin resistant, The regenerative agents will simply be metabolized. The environment dictates the outcome. If the soil is toxic, the seed cannot grow. This is why I require the metabolic audit. I treat the lab panel as a procedure. I cannot fix your spine if your blood chemistry is actively dissolving it. I cannot rebuild your knee if your systemic inflammation is telling your cells to tear down tissue rather than build it. At Regan.md, we are going to stop playing the game of find the sore spot and numb it. We are going to audit your system. We are going to identify the specific metabolic bottlenecks preventing tissue maintenance. We stop guessing. We leverage high-end data tools like Mesura.ai. We look at C-reactive protein, HbA1c, lipid profile, vitamin D, and homocysteine. We look at the biomarkers that define the quality of your internal terrain. This is the procedure. The analysis is the procedure. The metabolic optimization is the procedure. The injection, the needle, is merely the final localized signal to initiate repair. You have the opportunity to change your trajectory, but it requires you to be honest. The quick fix has failed you. If you are a high-level individual, a professional, an athlete, or a sovereign seeker, you need a protocol, not a procedure. Conclusion: the analytical strike. I have built my practice on a foundation of data-driven outcomes. I have built clinical empires. I have learned that the only thing that matters in the end is, did we improve the life of the patient? Health is your precious capital. If you want to believe a quick injection will cure 10 years of metabolic neglect, then please don't come here. There are other clinics for that. But if you are ready to do the analytical work, if you are ready to treat yourself like a complex biological system, then you are who we look for. This clinic is for the surgical candidate who understands the cost of structural loss. It is for those looking for a smarter, evidence-based path. Go to Regan.md, request a concierge evaluation. This is not for the assembly line. This is for the truth about your biological capacity. Let us look at your data. Let us determine if your body is failing to maintain its tissue and what must be done to fix the system. I am Dr. Gurpreet Singh Pata. Stop treating the signal, start auditing the system.